Well, a friend of mine had come here and she had it done, and she came back and she wasn't going to tell me, and I looked at her and I said, gosh, you look good. What have you done? You've done something, I know. And she told me, and I said, oh, I want to do it too, because it was so, and she'd heard from somebody else. And she was telling me about Petra and all the people at work here at the villa and how wonderful it was. So I booked, I think she had hers done a few months ago. So I booked, got on the plane, arrived at the airport, and the villa sends somebody for you, like a chauffeur kind of person. He speaks English, which is good because I don't speak Spanish. And he collects my luggage, puts it in the car, and then we came up all the hills, and it gets more beautiful as you, it's really gorgeous here. It's like you've died and gone to heaven. It's so, the tropics, the hills, it's beautiful. So we get here, and there's big security, which is, I'm happy with that, because when you're out of your own country, you don't know what goes on in countries. And so he comes and he calls with his cell phone, and they open the gates, big, massive gates, and we come in and the gates close, and they bought me, Petra met me, I think she's the manager, I don't know, she seems to oversee everything. She met me and took me to my room, and they were so nice. Are you okay? You're not nervous, whatever. I said, no, I'm fine. I was a little nervous because, everybody thinks in America, oh, you're going to get the best care. Well, it's not true, because the doctor here is American trained, and he's been doing this for years. He's a really good doctor. And so I came, and then I went to see the doctor. They took me, oh, I lied. I went from the airport to the doctor's office, and he took pictures of me, which, from what I've had my chin here, and a little bit on my back here. I had a little bit of chichone fat. And he took photographs, and the next morning I went to the hospital at 6. Got to the hospital, you have to check in, and you have to give them, your credit card, and then you can hand over your valuables. Everything is very, up and up, beautiful. So then, after that, I don't know how the time went, because I didn't have a watch on. You have to take no jewelry. I was taken to another room where they started to prep me. So they said, take your clothes off, and they gave me all, the little booties and everything. And they asked me questions as well, health questions, if I was, what normal people ask in a hospital. And then after that, they come and they take me to the operating room, and I must admit, I was frightened, because I've never been operated on. I've never had a medical procedure done, really. So I go in, and Dr. Alfaro, he was there, and the anesthesiologist, because that worried me too, the anesthesiologist, because, you worry more about them than you would a surgeon, because they can kill you, because they breathe for you. And I met him too, and the doctor had said he had used him for his family, so that made me more comfortable. And they bring me in, and the doctor came and he marked what he had to mark. I forgot that. And then I go in, and I'm lying there, and the next thing I know, I'm waking up. I didn't even remember going to sleep. And when I was waking up, the only thing, I became very cold. I don't know why. I was like probably because of the anesthesia. So they wrapped me in blankets, and they had to put these body things on. And then I was feeling, it wasn't excruciating pain, but it was uncomfortable. So they gave me a shot of something. I don't know what it was, because I don't know anything about medicine. And then I don't know where I went after that. I think they must have taken me to a room, because I must have been sleeping, because I remember being in my room. And then it was round the clock, monitoring the blood pressure. It was just, from then on, I stayed one night, round the clock all night. They got me up in the morning, they showered me. They don't leave you alone. They're like on you all the time, which is good, because you don't know what's going to happen. And I'm not, I'm a senior citizen, so it's...
So from there, you came back to...
And then they picked me up yesterday, and they brought me back. I had to pay my bills, and the stay in the hospital wasn't expensive. I mean, if I went for a night in America, I don't know, it would cost thousands and thousands. You could be broke just the one day. It wasn't that expensive. I was really shocked.
On that note, if I may ask,
yes.
And maybe we'll back up for just a second, and then we'll pick up, because I want to hear the rest of the story.
Go on.
Was your decision when you decided to have the surgery done? Was it financially based? Was it vacation based? Was it the recovery spa based? What?
No, it was vain. I couldn't stand my double chin.
But did you look into it in the United States?
No. It would have. You know how much it would have cost me? I did. I'm a liar. In the United States, it would have cost probably 3-4 times more there than what I have paid here. And I'm getting much better care. I mean, this room, I mean, it's gorgeous. You look outside, it's like you're in heaven. The mountains, and then this morning, it was really funny. It was like sunshine. All of a sudden, the cloud came right down. And it was like foggy. And then the cloud lifts, and I sat outside, and all this... The landscape, it's tropical, but it's absolutely gorgeous. Using my hands, aren't I? It's just beautiful. And I can call them, the United States, as much as I want. I can get on the phone, just do the area code and call, and they don't charge you for that too. And I was going to bring calling cards with me because my cell phone doesn't work here. But I'm really happy here.
Okay, so let's. So you're back here, and let's go ahead and walk through a little bit of your stay here. How's the food? That's something everybody asks.
Do you know, it's very healthy. Super healthy. I mean, the first day I was here, they gave me like a clear soup. I don't know what its name was, but it was delicious. For instance, today they gave me a beautiful salad, and then they had little tiny, might be of England, little sandwiches, like rectangle sandwiches. That was... Oh, breakfast, let me go for the breakfast. Breakfast was an egg and then all these mixed fruits. One of them was watermelon and the others, it might have been mango or something, I'm not sure. But it's all super healthy and I'm not hungry, by the way. In fact, I looked at it sometimes and think, God, can I eat this? Oh. So it's really, really, really good.
Okay, and now obviously another important factor is the medical attention here at the villa.
I have a nurse coming to me. She was here this morning. I had to go in the shower, and then they get out, and then she examined. I'm not a bleeder, so I don't have blood on me. A lot of people are bleeders, so I'm lucky. She examined me from head to toe, cleaned a little where the incisions were, took my blood pressure, takes my temperature, and I think she'll be back later. I don't know the actual schedules, because I've been kind of nodding. I'm probably got a bit of anesthesia in me still. The nurse is really sweet. She comes in before I go to sleep. And it's just fantastic.
Did you have any reservations about coming down to Costa Rica? Were you, what were your reservations, if any?
I didn't have any because it had been recommended. Now, if someone had said to me, go there, and the doctor had not been recommended, and this villa had not been recommended, I think I would have, thought twice about it. But because he was recommended, that's the only reason I came.
You know you're definitely paying it forward to somebody. Somebody's going to watch your video, and with your personality, this is definitely going to be a good thing.
No, I'm just saying I would not have come to to have someone, cut me open and make me more beautiful.
Sure.
But no, I came because 2 other people, one I didn't know, but I know her relatives, and then my friend, they came down and they were just overjoyed with this place. Most people have said to me, people I know, you must be out of your mind, this and that. I said, no, he's a good doctor, he's American trained. And I heard all about the rooms, and look at this, it's gorgeous, isn't it?
It is. It really is.
It's like out of a movie.
Yes.
Except
very much so.
Horror movie with the way I look now.
Let me ask on this is a lot of people are going to ask this question. Right. Financially speaking, you touched on this. It would have cost you about $25, but did you look into the prices in the United States?
What I paid for what I've just had done in the United States, it would have probably paid for an eye job, I think.
Really?
Oh yeah, the United States is a lot more expensive. I think this is considered like a mini facelift because I just wanted my chin and this area done. So I think it's worth every penny.